Hey guys, so it's been about 5 months since I made an update video. In the first week of November, I will be a year and 6 months on testosterone, and then 6 months post-op top surgery. And then on the 26th, I'll be turning 18. So it's pretty, you know, decently big month for me, especially because of the 18th birthday thing. Um, but yeah, so basically I'm still finding more hair on my body. There's not really any super drastic changes that I'm seeing, but I feel good and it feels right to me. My beard is filling in on the cheeks, but more so on this side barely. And I'm just waiting for everything to go through the process. Um, because taking testosterone, it counts as a second puberty in a sense, and puberty in itself lasts a couple of years, and for going on testosterone treatment, it takes about 6 to 8 years for your body to fully go through the motions of it, if that makes sense. Um, so yeah, and also if you're in between, if you are trans and in between getting top surgery, highly recommend it. If you're scared about the pain, don't worry about the pain, because you're gonna be in pain for like 2 weeks to a few months, and then you have this for the rest. Like, you have your chest and you can be comfortable, and you don't have to bind anymore, and you don't have to worry about it, and you're gonna, for me, I feel so much better. Um, and it's just taken so much stress out of my life, and just a lot of the thoughts in my head have subsided, because I'm like, oh my gosh, what if I'm not flat enough? What if they can tell? You can't tell anymore. And that is so amazing. Um, because I am who I am, and the person I see in the mirror now is exactly who I am, inside and out, and it just couldn't feel better. Um, but as for surgery, they they have these steri strips on you, and they have multiple layers of stitching. So it's the steri strips aren't there to hold you together; they're there to um, keep that incision tight, so the scarring is less. And during that first 2 weeks, your body's naturally going through that healing process of creating the scab and everything, which it'll do right in between that steri strip and your skin. Um, and as it heals, the steri strip will start just coming off, and that's the scab healing. So you don't want to remove that steri strip prematurely, because you're going to mess with the healing process and risk thicker scars. But if you're like me and you are not a patient person, and you have those steri strips on for about a week and a half, and you're like, I want to know what it looks like, then I understand you, and it's not super detrimental. You're going to get a little bit of a thicker scar than you could have had, than what could have been, but it's not like, you know, detrimental, as I'm saying. But yeah, just follow the surgeon's instructions. Make sure that you're covering the nipple grafts, and just making sure that you're applying your antibiotic ointment a few times a day, and changing that and letting it scab over and heal, and don't let it freak you out. It's a natural healing process, and this is how it'll look similar to. Here, I'm trying to. Well, I'm assuming. Whatever. But yeah. Ah. So that's basically all I wanted to say. Catch you guys later.